This is the worst situation hospitals in Washington state have been in compared to any prior point during the pandemic. We are experiencing a crisis across our medical system, and sadly, we've now just reached 1 million Washingtonians who have been infected with COVID-19. COVID-19 hospitalizations, which are currently at an average of 1,800 for the past week, have now exceeded our previous high of 1,700 in September of 2021. We've seen about a 65% increase in COVID-19 cases in the past week, and we've averaged 226 new COVID hospitalizations each day this past week, and roughly 12 to 20 COVID deaths. Of those in the hospital this past week, the average number of patients on a ventilator was 149, which was a 16% increase compared to last week's average of 129. There's also a significant shortage of staff and hospital beds. There are multiple factors that are converging to create this situation, and we're already in the midst of a sustained national staffing shortage. Similar to other job sectors, hospital staff are becoming infected with COVID-19 as a part of their daily lives, impacting their ability to work. And I would note that unlike other types of organizations, hospitals do not have the option to shut down operations.
In addition, you've heard about patients coming to facilities just asking for testing. And I'll have to emphasize that we have seen a marked increase in patients that are asymptomatic, have no symptoms whatsoever, but they're sitting in our waiting room saying, I was told I could come to this emergency department to get a test. That is so far from the truth. And as I've mentioned, it's already causing situations that we have not experienced in the recent past during the pandemic or ever during an influenza season. Therefore, I cannot overemphasize, if you are not sick enough to be seen in an emergency department, if you don't think your symptoms are severe enough to be seen in an emergency department, please contact your primary care provider. Please seek out care in an urgent care clinic, although they will not be able to provide that asymptomatic screening either. That's why you should contact your primary care provider or a local run testing center where you can set up appointments.
While we know that we've got this, we've been here before, there are some pain points that are straining our healthcare system and our teams right now. And probably one of the biggest pain points is we just have a math problem. With Omicron surging in the Puget Sound and more people coming into our hospitals for help, at the same time, Omicron is not really discerning between a healthcare worker and you. So we've been hit hard with healthcare workers who are out sick, and it makes it very difficult to care for the influx of patients that are coming in who need our help. So to manage that, we've had to make some pretty difficult choices around surgeries, and we've reduced our surgical capacity around 40%. We're doing all we can to continue to provide high quality care for our community. And we're utilizing agency staff, including nurses, if necessary. And we're considering updating the guidelines of the CDC to getting our caregivers back to work as safely and quickly as possible. So I do want you to know that our partners in the community, and many of those of us who are on the call today, we are monitoring this situation minute by minute. And we do have it. And it's really important that we're going to make it through this surge. And to do that, we're going to need a little bit of help from you. So get vaccinated or boosted, get tested, but please avoid the emergency department for testing. You should look to find a site near you, and you can go to the government website to find that. Mask up. And finally, please be kind to your local healthcare worker. We're doing our best to care for you and our community.